I'm Dr. Richard Evanson here at Plano Orthopedics. I'm a hip specialist and knee specialist. So one of the things I want to talk to you about today is about hip arthritis. This is a very common misconception of what exactly is hip arthritis. I'm going to simplify that, and hip arthritis is nothing more than a loss of cartilage. Okay, it's an inflammatory disease that leads to a loss of cartilage. So if you look here, in a joint, you have this articular cartilage on the end of our bones. That's the smooth surface or the smooth padding on the end of our bones. With time, that cartilage gets thinner. So you were born with a certain amount of cartilage, and that's all you get. Once it's gone, it's gone. So with time, that cartilage gets thinner. It's analogous to your brake pads in the car. Those brake pads start out this thick, and they get thinner and thinner with time till it's gone. Same thing with your cartilage. That's all arthritis is it's a loss of cartilage. So eventually your cartilage goes from this to where you no longer have cartilage. When you no longer have cartilage, that is arthritis, and that is what requires a hip replacement. So talking about hip replacement in particular, there's different ways to do that, okay? Traditionally, there's a posterior approach, there's a lateral approach. The problem with these approaches is that it requires you to cut through muscle and tendon in order to do the surgery. This ends up in, longer recovery time, more pain, more restrictions. You have to be very careful with what you do and how you do it after surgery. So a better approach is the anterior approach. So what I do is an anterior approach, and not only is it a smaller incision and less invasive, but the big advantage is the fact that I don't have to cut any muscle or tendon in order to do a hip replacement. So take it from me, I've done this over 10 years. I've done thousands of hip replacements. For the first 4 years of my career, as the Army trained me to do, was the traditional posterior lateral approach. It wasn't until I received my additional training and fellowship at Duke University where I learned to do the anterior approach, which I've been doing nothing but the anterior approach for the last 6 years, and I will never go back to that posterior approach. In regards to the differences in recovery of posterior approach versus an anterior approach, for example, when you have an anterior approach, you're able to immediately weight bear, you're immediately able to get up and walking. Your recovery would look something like this. You'd be up and walking in 2 to 3 hours, you go home the same day. So you can have some similar results after a posterior approach. However, a posterior approach, you have to be very careful with how you sit. You have to have an abduction pillow. You got to be careful with how you sleep. And there's all these different restrictions that you no longer have with an anterior approach. The other big benefit to having an anterior approach is there's a far less risk, lower risk of dislocation. So dislocation is where your hip replacement pops out of socket. So you can imagine if you disrupt all the muscles back here and have a larger incision, the chances of this popping out of socket like this, okay, or out front is a lot higher than doing an anterior approach where I don't have to cut or mess with any of the muscles or the tendons. So another common question that I get is who's a candidate for anterior approach and who should have a posterior approach. So in the right hands, with the right surgeon, everyone is a candidate for an anterior approach. So I never do the posterior approach unless it's a large revision or a special circumstance where they've already had a posterior approach. Then we may avoid making a second scar and go through the other approach. But in my hands, in my experience, the anterior approach is far better. And so everyone is a candidate for anterior approach, no matter your size, weight, habitus, doesn't matter. Typical recovery for an anterior approach will look something like this. You'll arrive to the surgery center, you'll have your surgery. Surgery takes me roughly 30 to 35 minutes. You're then going to be up and walking within 2 to 3 hours immediately after the surgery. You're going to go home, you're going to sleep in your own bed. Within 2 weeks, you're back to driving. 6 weeks, you're back to all activities. So the recovery is fairly fast, and that is specifically for an anterior approach. You'll come back and see us for a quick wound check at the 2-week mark, and then you'll see us also again at the 10-week mark for a quick evaluation to check your range of motion and strength. So if you're someone that's having hip pain, come on in, let's take an x-ray and take a look and see if this is something that we can help you with.